Social anxiety disorder and insights into social anxiety treatment. Very important topic, and I think, unfortunately, a lot of people do suffer from this issue, and I think it's been exacerbated, especially since the pandemic, and it's really, really going to be an issue of the future, I believe, in light of what we've been experiencing in 2020 and up until now, and especially, in my opinion, the effect that social media has on a lot of issues related to social anxiety disorder. So let's take a look at this article. It's from Medical News Today. Article is entitled "What to Know About Social Anxiety Disorder." There's a brief caption here that says, social anxiety disorder is a mental health condition characterized by a fear of being watched or judged by others in social situations. Social anxiety disorder is also known as social phobia. Anxiety is a fear that arises in anticipation of an event, and a phobia is an irrational fear of certain objects or situations. The National Institute of Mental Health reports that 12.1% of adults in the United States experience social anxiety disorder. Wow. At some point in their life. It is more common in females than in males. However, social anxiety disorder is treatable. Talking therapy, cognitive behavioral therapy, CBT, and medications can help people overcome their symptoms. This article provides an overview of social anxiety disorder, including symptoms, causes, diagnosis, and treatment. So let's see. What is social anxiety disorder? People with social anxiety disorder are fearful of or anxious about certain social situations due to a fear of negative judgment, embarrassment, or rejection. Although some social anxiety is usual in social situations, such as when giving a presentation or going on a date, social anxiety disorder refers to anxiety that is intense, affects work or personal life, and lasts for at least 6 months. People with social anxiety disorder may feel worried about appearing anxious, such as blushing or trembling, or about other things that they are awkward or intelligent. Many people also have strong physical symptoms, such as an increased heart rate, feeling sick, or sweating. Although the person may acknowledge that their fear is excessive, the anxiety often feels overpowering and out of their control. The triggers of social anxieties vary among people, but may include meeting unfamiliar people, talking to people at work or school, being called on to speak in class, having to talk to a cashier in a store, using a public restroom, being seen when eating or drinking, having to perform in front of others. Please comment below. Do you feel any sort of social anxiety situations in any of those of the bullets that I just mentioned? Please comment below and let me know. Well, just share with others. Is it a situation that is very problematic, especially in those kind of situations? Many people with this condition do not seek treatment, believing it is just part of their personality. They may instead seek help for related issues such as depression or substance abuse. I think that's really important to point out that this is not part of your personality. This is just a certain other issue going on that I think people can really seek the proper treatment or get the proper help they need, and this is not who you are. So very important to point that out. Okay. Symptoms. So just some of the symptoms that they list here may be feelings of panic or panic attacks. I'm just going to list some in no particular order. An intense fear of judgment from others, having difficulty speaking, avoiding situations that might trigger anxiety, a rigid body posture, and a soft voice during social interactions, difficulty making or maintaining eye contact, sensitivity to criticism, low self-esteem, and negative self-talk. Just scrolling down a little bit more in this article. In children, the symptoms appear in interactions with both adults and peers. Their feelings of anxiety might appear as crying, throwing tantrums, freezing, shrinking, clinging to a parent or caregiver, not speaking in social situations. So some of the treatments that they're talking about here, and again, this seek your own doctor, get your own medical advice from your own personal doctor who knows you and your situation, or if you don't have one, find the right one that works for you. But at the end of the day, it has to be what works for you, what you're most comfortable with, and how you want to deal with it. So seek professional guidance for that. But according to this article, they say healthcare professionals will usually recommend treatment with psychotherapy, medication, or both. This section below will look at these options in more detail. Psychotherapy or talking therapy helps people understand their experiences and develop effective coping methods. There are many types of therapies that they've mentioned there, including interpersonal therapy, psychodynamic therapy, family therapy, medications, but again, speak to your doctor if that's right for you. Antidepressants they talk about. Other types of medication they also speak about. So you can look at the article in more detail when you have a convenient opportunity. And there's something here called beta blockers, which is beta blockers help block the physical effects of anxiety, such as sweating, tremors, and rapid heartbeat. They do this by blocking the stimulating effects of adrenaline. Doctors usually prescribe these drugs for specific situations, such as having to give a presentation, but not for ongoing treatment. Tips for overcoming anxiety. Just be very brief about this, and then you can read this in your own time. Increase social situations gradually, which I think is very important. You have to, if you're not doing that, and that is a big fear of yours, really do it in a gradual way that is comfortable for you. And then you can read what the article says about that. Take time to relax. Engaging in mood-boosting activities releases feel-good chemicals in the brain, which can relieve stress and make a person feel better about their feelings of anxiety. Reframe your thoughts. If a person holds on to the idea that they are shy, it will reinforce current anxiety about talking to people or being in public. Thoughts fuel behavior patterns. Avoid relying on alcohol. And then it says here, diagnosis. A doctor may ask questions about the person's medical history and carry out a physical exam to rule out any physical causes of their symptoms. They may refer the person to a mental health professional. A mental health professional will ask the person about their symptoms, including when they occur, how often they occur, and why they have started. And then it goes into causes and risks, and it's just a very detailed article about different points related to that. And then summary, social anxiety disorder is a relatively common mental health condition. Symptoms include intense fear of certain social situations, a fear of ridicule, and a strong desire to avoid social situations. When severe or without treatment, the condition can be debilitating. However, with effective intervention, which might include talking therapies, medications, or both, people can greatly improve their quality of life. So look, I think in the end of the day, and you can read that article more in detail and find other articles that may be better or more helpful, but I just wanted to point out the fact that I think social anxiety and social anxiety disorder is very common and prevalent in many societies, really virtually everywhere around the world. And I think the more, especially that you engage as much as you're comfortable with in social settings, and like the article said, gradually and in ways that really can get you into a situation that makes you feel comfortable speaking with other people, and then maybe really getting a good friend of yours to help you be accountable to be in better social settings. Even ask them, say, hey, look, I need to improve on this. I would like to be better with public speaking. I would like to be better with being around other people. I'd like to be, more in groups and just, shoot the, I won't say it on this recording, but basically just, speak without filter in a way that is fun and exciting, but not offensive, but just open, right? And I think, anything that's medical related or anything of that nature, seek your doctor out. That's your own personal way of having to seek out things that are more deeply related to medicine and medication, things like that. That's for an expert doctor to help you with, if that may need be. However, the more you can try to do yourself, but also have a good accountability partner, I think, in my opinion, to help you become more social and develop certain social skills and have less fear in general in those situations, the better. So comment below. Is it an issue you think that's really, really prevalent in our time? Is it a difficult issue for people even in your life, or people that you notice, as they engage with the world? Is a really important topic we must face and try to help others with? Please comment below. It would be great to know, and hope you're all well. Have a great day, everyone.